Hi everyone, welcome to HPAL's blog. Today we have Dr. Blair, an alum who graduated from Maryland in 2004 and is currently a practicing orthopedic surgeon. While at UMD, he was one of the original peer mentors for CMNS. Dr. Blair is also an Army veteran. Thank you for your service. And during his active duty in the Army, Dr. Blair was deployed to Afghanistan and Syria and was awarded the Bronze Star Medal in 2015. Today, we will be reflecting on his journey to medicine. Thank you for being with us today.
Thank you for having me. This is great.
Yeah. So my first question for you is, what made you try medicine? Maybe what year were you when you started thinking like, I want to enter medicine?
Yeah, that's a great question. I was one of those weird kids where I just sort of knew that that's what I wanted to do. I wish I had a better explanation of it. There was nothing special that happened to me. I just knew when I was like, I went to high school knowing that I wanted to be not only a doctor, but I wanted to be a surgeon. It's as cliche as it comes, and that's just what I did. No one in my family did healthcare. My dad was a high school administrator. My mom was a guidance counselor. So it's not like I grew up around it. So I was one of the lucky or unlucky few that just kind of got tapped for it. I'm glad it all worked out because I really didn't have a contingency plan if it didn't. But I went to high school and eventually college at the University of Maryland, knowing that that's what I wanted to do, and that was sort of the focus with everything that I did.
Okay, that makes sense. What made you choose specifically orthopedic surgery? And then I think on your profile, you also had orthopedic trauma. So what kind of helped you decide what specialty you wanted to be in?
Yeah, so that decision really doesn't need to get made until really about your third year of medical school. There's plenty of people that go to medical school that have no idea what exactly they want to do, that they just have an idea of like, I want to be a doctor of some type and I want to be a physician. And I will use medical school to figure it out. And that is completely fine. And I think that probably most people fit into that category. For me, I knew I wanted to do something with my hands. I knew I wanted to do something physical. And the nice thing about orthopedics is it's a very tangible field. We work with bones and joints. And so, it's something you can see. It's something you can look at on an X-ray or an MRI or a CT scan. It's something that you operate and you touch a patient and you can feel their problem, you can see their problem. And so to me, that was very intriguing. And it's a very satisfying, gratifying field. And so, and then the next question is about as far from orthopedic trauma, there's a bunch of different fields in orthopedic surgery in general. For example, sports medicine, total joint replacement, spine, pediatrics, things like that. And for me, I think part of it was my draw to the military. And just a background about that, again, dating myself a little bit, but the events of September 11th, 2001, I was a sophomore at the University of Maryland. And so I specifically remember that day. I came home from a chemistry lab a little bit early, and my girlfriend, was now my wife, and my buddy just came barging into my room saying that the Twin Towers had been hit. And we could go to the top of what was then Byrd Stadium, and you could see the smoke rising from the Pentagon. And so we knew that this was real, that something was happening. And I wanted to do my part, as big or as little as it was. I had friends, I knew people who dropped out of school and enlisted in the military, and I never saw them again. Who knows what happened. But I felt that probably wasn't my calling. I was like, okay, I still want to be a doctor. I still want to do this. Maybe I'll look into the military to do that. And so during my residency training in San Antonio, Texas, at a military hospital, which is the only level 1 trauma center in the Department of Defense, we were seeing the soldiers coming back from Iraq and Afghanistan with these horrific injuries. I mean, these are some of the sickest people in the country, 23-year-old males who are in the prime of their life, with these devastating extremity injuries. And I said to myself, man, if I can take care of these guys, I can do anything. I can take care of anything in the United States. And so that's really what drew me to trauma. I had a great mentor that I latched onto, who was an orthopedic trauma surgeon, and the rest is history. I did my trauma training fellowship and have been in practice ever since.
Oh, that's really cool. Yeah. I guess to follow up on that, we have a lot of pre-health Terps who are interested in joining the military. I think just being that we're so close to Washington, D.C., and we have Walter Reed like right here. Do you have any advice for pre-health students who are interested in joining the military?
I think my best advice would be to find somebody who is active duty, who basically is doing the job that you think you want to do, and try to get in touch with them and try to get some honest opinions about it. I think that there's a lot of people who have very biased opinions, whether it's positive or negative about the military, and it's not for everybody. And I think that if you can find somebody, for example, if you want to be a nurse, if you want to be an ICU nurse, if you want to be a physical therapist, if you want to be a physician, the fact that Walter Reed is so close to the University of Maryland, College Park, I think it would be pretty easy to find mentors, and just say, hey, I'm interested in doing what you're doing. Here's my story. What do you think? And so that would probably be the highest yield advice I could probably get. I'd probably give somebody who's coming through. You talk to a recruiter, again, realize that the job of a recruiter is to get you to sign the paper and is to get you to sign on the dotted line. And so, but while I don't think that they're being necessarily lying to people or not necessarily being forthcoming, realize they have a biased view and they're not necessarily walking the walk of being in that position. So try to find someone as best you can and get the inside scoop as to really what it is, and then make a decision from there.
Yeah, that makes sense. I think just like for my own curiosity, I can see a lot of parallels between being in the Army and maybe medicine, given that they're both service oriented. I can also imagine maybe the teamwork, the discipline that goes into being in both fields. Is there anything that you learned while being in the Army and ultimately it impacts how you practice medicine today?
Sure, I think you nailed it. It's the teamwork. It's especially in the military, when we deploy, we're on these relatively small teams, and so I was on what's known as a forward surgical team or a forward resuscitative surgical team, and this is a group of 20 people. We have a general surgeon, we have an orthopedic surgeon, some anesthesia providers, some medics, and things like that, and then usually that group of 20 splits into two teams of 10. So we have very small units that we were with, and we were going far forward in Afghanistan, and I happened to go to Syria as well. And so you've got to be able to work with the team. You've got to be able to work with people who come from different backgrounds. You got to be able to work with people who have different skill sets. You've got to be able to work with people who have similar skill sets. And I think that all of those things are vitally important. And the same thing goes in medicine, especially in the world of surgery. When you're a surgeon, you're the captain of the ship. And when we're in the operating room, everything falls on you. So when I'm operating, everything falls on me. And so I've got to be able to run my team. And that consists of circulating nurses and scrub techs and medical students and residents and the anesthesia team. And ultimately, because the patient's outcome, the patient's well-being is really falls on my shoulders. And so you've got to be able to manage a team. And I think that there's great leadership parallels between medicine and being in the military, 100%.
Right. I'm going to be shifting back to a little bit maybe undergraduate and medical school years. Given that you have hindsight now, do you think there were certain activities, they could be co-curricular or extracurricular activities that are related to medicine or not related to medicine, that you think ultimately you're really glad you did, you would recommend to other pre-health students?
Yeah, absolutely. Thinking about this, I think probably the number one thing for me is, when I was applying for medical school, I think I was a very average applicant, probably above average student, but from an applicant standpoint, or people who are applying to medical school, I had decent grades. I didn't have the best grades. I had decent MCATs, not the best MCATs. I needed something that made me different. Why is someone going to choose me over somebody else? And I think for me, to be honest, I was in the marching band at the University of Maryland. I was in the drum line for 4 years. Squad leader my junior year. I was a section leader my senior year. And in those years, again, we're going back to the early 2000s. So we went to the Orange Bowl, the Peach Bowl, and the Gator Bowl. And I mean, those were unique life experiences. 19 years old, getting athletic per diem to spend New Year's on South Beach, all expense paid trip, was pretty cool. And so, and then I carried that through, and I marched competitive drum corps for 3 seasons, for 3 summers while I was at the University of Maryland. And so that not only instilled in me a discipline, a dedication to a craft. It was like, look, I like playing the drums. I love it. and still to this day, I turned 40 years old in July. I still think about the exercises that we used to do, and constant songs kind of running through my mind. And there's a lot of manual dexterity to it. When you play an instrument, and again, it doesn't have to be the drums, you play any instrument, there's very fine motor control that you need with your face, with your arms, with your fingers and things like that. I think a lot of that skill set carries completely to like the field of surgery. And so I think that was something that made me different. It was something I talked about in my personal statement, and it was something that I didn't think that everyone would do. I played a lot of sports when I was at the University of Maryland, a lot of intramural sports, and every single season we were doing something. So I mean, that was fun, but a lot of people do that. There was only a few of us that were in marching band, especially for 4 years, that were applying to medical school. I undoubtedly think that gave me something unique that I could talk about in my interviews, and gave me a skill set that I could fall back on, even when I was in the military. Of, we're doing a lot of hard work. We're striving for perfection every single time that we take the field, and we're doing, whatever songs and exercises and things. That's something that 100%, I think it probably got me into medical school. I'll be honest. That's probably what it was.
No, I think that's really interesting. I think one time I was talking to Wendy about, because I used to dance, like the whole process of like practicing for something and then having to execute. I can see that similarly in marching band and in just like an operation room.
100%. And something that's not medically related at all. That's not science related, arts and humanities and things like that. I mean, those things are what make people interesting. The people who are, the science majors, and that's all they've done all their life, and they've done nothing else but study, and they have, straight A's, and they ace the MCAT and things like that. Okay, but that's kind of boring. Like there's nothing, like what do you talk about to somebody about that? Like I want to see somebody, I'll take somebody who's got slightly less grades, but is more of a human, has more of a human element in their application and the way that they do things. They've traveled, they've gone on trips, they've done some volunteer work and things like that. They have something that they can talk about, rather than the absolute academic machine who has done nothing but study the whole time. And again, the studying is important. I'm not saying it's not, but there needs to be something else behind the application.
Yeah, I think you bring up a lot of good points. I think especially with the manual dexterity point, I think specifically with pre-dental applications, that's something they really look for. So I think that would be a great activity for the students.
Yeah, that's a great point.
It also mentioned in your profile that you were a teaching faculty at William Beaumont Army Medical Center and Texas Tech University. Do you have any advice for students who are interested in going into academic medicine or teaching at an institution in the future?
Yeah, I think, and those are the positions that I had when I was in the military. Right now, I'm at the Medical College of Georgia in Augusta, Georgia, and I teach there. I have residents, I have medical students, and I'm part of the faculty there at the medical school. And I think that people, I think that there's a certain person who enjoys doing that. It's as far as like the pay goes, I mean, sure, I could be in private practice and making more, but like you lose a certain part of it. I really want to be able to contribute and give back to, basically make people who help me, and realize that like, hey, I did you well, I did you good, and let me pay that forward. I think that I have a lot of ideas as far as how to teach, and realize that look, I'll be honest, I'm not the smartest guy in the world, and so if I explain to you something that's how I would want to explain, like, then I can probably get through to you. And I think that that's kind of just a drive that I've sort of always had. I think if you think you might be interested in that, look for teaching opportunities when you're in undergrad. Look for TA assignments that you can do, other leadership things that you can do as far, being a tutor and things like that. I think you can sort of get a flavor of it, and you can really see the impact. And for some people, they say, no, this isn't for me. And other people, they say, I love doing this. I couldn't see myself doing anything else. And so I probably fall into the latter, where I love doing it. I was, a cell biology TA back in the day. And I really like doing that. I taught for Kaplan after I took my MCAS, because the Kaplan Test Center was like right across the street from my apartment that I lived in when I was in College Park. And that was a great side gig that I did when I was a senior in college. And I said, I actually really like doing this, because I think that I can get through to people the way that people got through to me.
Yeah, I think that's great to hear. I think a huge question we hear during our introduction workshops, which has underclassmen usually present, is tips for shadowing someone and things like that. I kind of want to have your take on maybe what are some pet peeves you have in terms of mentoring some students, and what are some things that students should do when they are interacting with their mentor and things that they should not do.
I think sometimes it's just as easy as sending an email, as sending a well-constructed, thought-out email. And again, it doesn't need to be very long, but again, I think that people, especially in the medical world and the people in especially the surgical world, a lot of it's attention to detail. And so sending sort of like a half-crafted email with like punctuation errors and spelling errors and things like that, to me, it's like that's your first impression, right? As you're sending it, you're cold emailing somebody and saying, hey, Dr. Blair, I'm really interested in X, Y, and Z. I was wondering, is there any possibility that I could spend some time shadowing you? I'm really interested in learning more about just medicine in general. And I think that that is completely fine. And I think a lot of us have no problems responding to that positively in any way at all. And so then I think the pet peeve that I probably have is when somebody says they're going to do something and they don't do it. It's like, yeah, I'd love to meet you. When can we meet? Say, hey, why don't you swing by my office at 9 o'clock? And say, okay, sounds good, great. And it's like, I go out of my way to try to be there for that student. And then all of a sudden it's 9:10, 9:15, and they're not there. And then it kind of comes strolling in at 9:20. And it's like, hey, like, where were you? What happened? And so I think that, it's being understanding and being respectful of time of those kind of like in the professional world. It's like, look, we got patients that I got to see. I got clinic. I need to be in the operating room. I have other requirements. I feel I really want to help you out, but you got to kind of meet me halfway. If you say you're going to be at a certain spot, be at a certain spot. And then I think the other thing is, realize that you're in a place of business, you're in a place of work, you're in a place of healing, you're in the hospital, is just trying to act as professional as possible. And I'll tell you, I did not know what that meant when I was, 20 years old, junior in college. And it sort of took me a while to sort of mature a little bit and grow up and be like, oh, I see. I'm supposed to act like this and not like that. And that, even though it's just a volunteer shadowing mentoring thing, think of it like a job, and say, okay, I'm coming to work. I'm going to dress in whatever way they want me to dress, and I'm going to do this. And we maybe go into the operating room and just kind of understand that you're going to interact with other people that are part of a workplace. And so I think those are probably the biggest things to do.
Yeah, I think that's great advice. I think also being inside an operating room, it's a very different environment than maybe a normal office. So those are things.
Very different, very
Yeah.
different. There's a lot of things to get used to. And I think that if you do that as an undergraduate, or even as a early medical student, I think that that's huge, because there's a bit of discipline that kind of goes into being in the operating room. There's a bit of etiquette that goes in, and you're a lot better kind of making mistakes as an undergraduate, and then you get to medical school and you're like, oh, I've been in the operating room before, like I understand what I'm supposed to do and what I'm not supposed to do and things like that. That becomes a lot easier. And so I think that taking those opportunities is huge.
Yeah, definitely. So, my next follow-up question is about specifically the specialty of surgery. I think we have a huge interest from my conversations with peers and other underclassmen. I think even now someone recently started the pre-surgical society at Maryland. So there's huge interest. Is there any advice you have for pre-med students who are specifically interested in surgery? Maybe some resources to look into, just general advice.
Yeah, I think that it probably goes along with my earlier answer, in that try to get in touch with somebody. The awesome thing about being in College Park is you're right next to DC. You're really close to Baltimore. There's so many resources that you have. There's so many hospitals. There's so many programs that different hospitals have. And so, for example, there's a couple different societies, a couple different organizations that are really geared toward undergraduate students who are interested in medicine. For example, the Ruth Jackson Society kind of caters a little bit more towards orthopedics, but it's basically looking at, we're trying to get women and underrepresented minorities into the medical field. I think that we as a subspecialty, for example, especially orthopedics, and I think medicine as a whole, I think appreciate that, there's 6% of us are women. And so I think that it's something that we say, but that's not our population that we take care of. That's not what's in medical school. Why is that the case? And I think it's sort of dispelling some myths and being more welcoming towards women, underrepresented minorities, and trying to say, hey, look, we understand what we look like. We understand what we're doing, that this is a field dominated by white males. And so we're trying to be more inclusive. We're going out of our way to improve our diversity. And so the Nth Dimension has programs, like I said, the Ruth Jackson Orthopedic Society is a great resource, and these are specifically for like non-medical students. So for undergraduates who are interested, and they have workshops and there's meetings and there's grants that you can apply to go to these national meetings and things like that. Aside, along with, they also have mentoring opportunities as well that I think that a lot of people find very helpful. And again, to see, is this really what I want to do? Do I think I want to do surgery? Maybe, but then all of a sudden you get to see some different things and you're like, you know what, this isn't what I thought it was. Those are real big decisions to make, really before going into medical school, if you're able to. Now, again, if you're undecided, I think that that's completely fine. But if you think it's either surgery or nothing, and then you get into the operating room and you're like, I hate this, then you probably shouldn't go to medical school if that's the only thing you can see yourself doing.
Yeah, I think you bring up a lot of good points because we have a lot of students who come in who are stuck between pre-MD and pre-PA. And so if they're exclusively trying to do surgery, then obviously you would have to be in the MD route. So I think you bring up a great point there. I have a question guarded more towards our maybe students who are applying soon. So when they're writing their personal statement and essays, I think something the HPAL office says a lot is know your audience. So a lot of the people who are reviewing these applications are doctors. So you don't want to kind of be tone deaf in explaining medicine when it's not actually what medicine looks like. So given that, with your years of practice now under your belt, what does medicine mean to you? What are some misconceptions that you think like a normal person might hold about medicine? Yeah.
So I think that's an interesting question. I think, so I think that, really the question that I see is, has medicine kind of changed since, has my perception of medicine changed since I sort of, were in your position kind of coming through? And I would say not a ton. I think medicine is, again, the field has evolved, medicine has evolved, but it's still kind of the same. I think that there are certain nuances that have sort of changed a little bit, as far as how medical school is being taught and how residency and surgical education and graduate medical education has all been taught. And I think that some of those things are evolving, but I don't think that there's been a marked change in the way that we do things. For the most part, I think, there's a lot of personal skills that you need to have as far as communication goes when you're breaking bad news to patients, and you're talking to patients, and you're cracking good news, and you're meeting a trauma patient in the ER on the worst day of their life because they crashed their car and they broke both their legs. These are all real things that we do, and that really hasn't changed too much. The way we do things has changed, but as far as medicine as a whole, not really. I wouldn't say so. And so I think as far as your audience goes, realize that the people reading these applications are usually faculty members of the medical school, and then usually other medical students as well. Most medical schools will have a medical school admissions committee, and it could be a selection of 10 to maybe even 25 medical students that will kind of review some applications and things like that. So I think that's kind of your audience. And so realize that your audience knows way more about any type of medicine than you probably do. And that's okay. That's expected. If we're reviewing applications, we don't expect that. What we're looking for is, a well-rounded applicant, who we think is gonna succeed in the medical school. That's really what we're looking for. Again, the academic robot who, aced everything and does everything, but that's all they do. Again, are they going to get in medical school? Possibly, but again, realize that that it's more to it than that. And I think that many schools these days see the human element of it and would probably rather take somebody with slightly lower scores, but has a more interesting story, who's a more well-rounded applicant, a more well-rounded human being, has got more life experiences. Because I think that those are the ones who probably succeed a little bit better in medical school than the academic robot, really.
Yeah, I think that's a great point. You kind of hinted at this already, but now that you've worked with so many different, I guess, pre-health professionals, what are your top 3 competencies that you think every physician, every pre-med student should have? Yeah.
So I think competencies that people need to have, you need to be able to talk to people, and you need to be able to communicate. If you are unable to have, to sit down and have a conversation with somebody, I think that it sounds kind of silly, but realize that it is actually a skill set, to sit down and be charismatic. Now, again, there's a lot of introverts that go into medicine, and there's a lot of extroverts that go into medicine. I'm not saying you need to be one or the other, but still, if you're very introverted, you've still got to be able to have the skill set where you can sit down with somebody, and you can sit down with a patient and do an examination and talk to somebody and explain things. And so I think, like, being able to communicate, I think is number one. Number two, as I'd say, you need to be able to read. And I know it sounds silly, but being able to read critically will be probably the be all end all of your success, at least in your first 2 years of medical school, because the first 2 years is drinking from a fire hydrant. I mean, it is tough. I think a lot of us, myself included, got by college sort of on just kind of natural skill and ability. I didn't learn how to study until I got to medical school. And I think that was probably one of the biggest things. And I had so many classes that said, "Oh, this is how you should really study. Here's some study skills and blah, blah." And I was like, "Hey, yeah, whatever. Like, I got this. I got this." And I really did. I got by. I did fine in undergrad. I got into medical school. And then when all of a sudden the volume of information came hurtling toward me, I'm like, whoa, I actually don't really have an idea how to truly study. All those silly things that I learned as a freshman, I started then implementing 4 years later in medical school. And so I think, learn how to speak to people, learn how to read, learn how to study, I think are probably the biggest things. And because if I had studied in college the way I did in medical school, college would have been a joke. It would have been an absolute joke, and I thought I had hard classes. I had nothing compared to what I did in medical school. And so that was a skill set I wish I kind of had. And then I think, if the last little bit, gosh, it's something I kind of regret doing, is learn a foreign language. If you learn a foreign language, and again, it can be Spanish, it can be German, it can be Mandarin, it can be, anything. Like, you broaden your horizon, you increase the number of people that you can communicate with, by potentially tens of millions, if not billions of people. And so, again, I grew up in Northeastern Connecticut. I went to the University of Maryland, and I went to medical school in Philadelphia. I never thought in a million years that I would live in West Texas on the US-Mexico border. I never thought that. I took French in high school. That was pretty useless. If I could go back and do anything differently, it would be, I wish I had took Spanish when I was in college. I wish I had taken it all 4 years, and I wish I had done like some type of immersion program and had been as fluent as possible, because I think that some physician-patient interactions that I had probably suffered because I didn't have that communication skill set by having to rely on an interpreter. And again, I picked up a lot as I went through, but probably not enough to have like a meaningful conversation with somebody, explaining to them the nature of their ankle fracture and how we're going to fix it. So I think that that would probably, if you have that skill set, I think that is absolutely huge.
Yeah, I think that's really exciting to hear. A lot of our pre-med students are like double majoring in Spanish, and they have a huge interest in medical Spanish. So I think that would be really helpful.
I think that's perfect. I mean, again, especially in the United States, and again, growing in Northeastern Connecticut, we had more French Canadians than people speaking Spanish. And then, but again, you look at the secondary language of this country, the most likely is going to be probably Spanish. And so I think that is a huge skill set. I knew people who knew Vietnamese. I knew people who, again, knew Mandarin, and they used those skill sets when it came up. And I think that was, again, that is what a skill set that I wish I had.
Yeah, I can imagine also like maybe the cultural component of it too, where like once you learn a new language, you might become more culturally competent and just like learning how maybe like other traditions and things like that. So
100%, 100%. And I think that there's a lot of stuff that gets learned by accident, and even myself, being, like I said, living in El Paso, Texas, literally right, I can see the US Mexico border from my house, and so, realizing that there's such a huge population that I struggle to communicate with. These are people that have real problems, and they were my patients constantly. It was tough for me, and it was really a regret from my standpoint, and I wish I had taken more opportunity to learn something, and again, or maybe just continue taking French, because the only time that I really found French to be useful, again, in my life, was when I went to Africa. Central Africa, anyone with an education speaks French, and anyone with an advanced education speaks English, at least where we were in Central Africa. And so I actually used more French in Africa than I had pretty much anywhere else. And so that was somewhat useful, but I still probably would have wish I had taken Spanish.
yeah, I'm kind of jumping back here, but I know you mentioned previously in your email that you were in a couple of humanitarian missions. Could you explain a little bit more about what you did there and maybe things you learned?
Yeah, they were all through the military, or through the army, and just kind of were opportunities that I had, and a lot of them were opportunities that I volunteered for, and opportunities that I was told I was going to do. So I went to Honduras twice, to Tegucigalpa and the Hospital Escuela, and that was amazing. I went as a third-year resident, and then I went again as a fifth-year resident. The first time we went was sort of like with a hand and upper extremity focus. And then the second time I went was sort of from a post-traumatic deformity correction focus. And it was amazing. We spent, we would go on these 2-week missions. We'd have a small team of 7 or 8 of us. And we would go to this one hospital. They knew we were coming, and every single doctor pretty much in the country knew that on a certain date there were going to be some American doctors that were going to be at this one clinic, and if you had an orthopedic problem that you wanted them to look at, you had to be there. And so we'd see 100 patients or so in clinic, and then we would just sign up patients for surgery, and we would take care of them to the best of our ability. And so we did that. And again, like I said, I did that twice in Honduras, and I mean, it was a fantastic experience. I mean, it was great. Again, it's a resource limited country. And so I think that the skills that we learned were how to deal, number one, with a team that you may not necessarily have a language in common with, but your commonality is medicine. We're still doing operations that it's the same kind of operations that they do. And so, we're flexing a skill set of being able to operate more in an austere environment, operate more with a resource limited environment, and really helping out as many people as we can. I later went to Bujumbura, Burundi, which is in Central Africa, just south of Rwanda. And that was also on a military mission. We were there for another 2 weeks and helped out their military hospital as well. And again, never in a million years was a kid from rural Connecticut did I ever think I was going to go to Central Africa. It was an amazing experience. And again, sort of similar things, working in a really resource limited environment, teaching some of their surgeons some techniques that we feel that they could do with kind of limited implants and limited instruments and things like that. And we made a lot of great relationships. And then the last one I went to the Republic of Georgia, which is in Eastern Europe. We were there between Tbilisi, which is the capital, and Gori, which is kind of central. And in Gori, Georgia, that's where their main military hospital is. And so I went as a single person mission. It was just me that went, which was wild and sort of a whole other story into itself. But again, just went to the Republic of Georgia. I was there for a couple of weeks, helping out them. It was mostly for like amputee rehabilitation and surgical skills and things like that. And really saw, what was a war-torn Eastern European country that was, ironically enough, slowly being invaded by the Russians from the north, and trying to rebuild their country. And the interesting thing about the Republic of Georgia is that at the time, they put more soldiers into NATO than any other country per capita other than the UK. So they had a lot of military forces in the wars in Iraq and Afghanistan, along with NATO. And so they had a huge burden of military type of injuries. And, again, being an orthopedic trauma surgeon in the military, basically my superior said, you're the guy, you're going to go down and help them out as much as you can, helping with their units and just building relationships between the US and our allies. And so I learned a lot of life skills. I learned how to travel to strange European countries. At least it's strange to me because the alphabet is nothing like I've seen, and just trying to get around. And it was the first time I'd really spent any time in Europe. And so again, learned a lot about myself, learned a lot about medicine, learned a lot about medicine in other countries. And there were experiences that no amount of money could ever buy. It was kind of being at the right place at the right time in the military, and I would have never given enough for anything.
Yeah, I think that's really interesting. I like, even when I have gone to a foreign country and I don't speak the language, now I understand maybe immigrants who are in the US who don't speak the language. I think it really maybe shifts your perspective. But yeah.
100%. And all of a sudden you realize, like, oh, okay, this is how this is. And again, especially being a Caucasian in the United States, and maybe not really thinking of it. And then all of a sudden you go to even Eastern Europe, and you look around, you say, geez, even I look different than these people. Like, and imagine somebody in the United States, who looks very different than the average person, and again, even being in El Paso, where 80% of the population is Hispanic, it's a little bit different, and it really shifts your perspective. And I think that it really changes the way that you think, I think, for the better. And I think it helps you relate to patients a lot better. I think it helps you relate to families and, like you said before, cultures and traditions that maybe you've never been exposed to when you were growing up. And so I think that all those things made me not only a better person, but a better physician as well.
Yeah, I think one theme I'm just hearing from this conversation is, I think someone might expect going into the military that they're serving their country is the number one priority. But I think another thing that you got out of it is that, like, cultural competency and like going outside of maybe what you're normally comfortable with. But yeah, those are all my questions. Is there anything else you would like to share to our pre-health Terps before we end this interview?
I think that just reiterating that I would not have given my education up for anything. Like we were kind of mentioned before we started, you have memorial chapels in your background. I got married there. I met my wife at Ellicott Hall. We're still married. We have 2 kids and 2 dogs, and we live in Augusta, Georgia now. And it's crazy that all these things kind of stem from my experience at the University of Maryland. And I think that there were so many resources that we had that I utilized, and probably a lot of resources that I didn't utilize that I just didn't even know it existed. And I think that the advice that I could give is, understand what your resources are, and utilize them to the best of your ability. And then once you do so, and you kind of get to where you want to be, help give back and go back and help those people that, remember how stressed you were when you were an undergrad trying to get into medical school, and then realize that once you're in medical school, it's like, oh wow, I'm so grateful for the opportunity to be able to do what I do. I think that there's a lot of people in this world that are not happy with their lives and their jobs and things like that, and would love to have a career change. I'm very fortunate in that I love my job. I love what I do. I'm really glad it worked out, because if I don't know what I would do if I didn't. And so I think that a lot of it was from the opportunities that I had at the University of Maryland, being so close to Washington, D.C., and being so close to Baltimore and things like that. And so I think, so in closing, use your opportunities, understand how fortunate you are to be at a school like Maryland, and realize that it's always a conversation starter when someone is like, hey, where are you from? It's like, well, I mean, I grew up in Connecticut, but I really felt like I was from Maryland, and especially, Baltimore, and shock trauma is right there. And I had people that train there, and it's, people trying to go to University of Maryland Medical School and things. It's like, yeah, I was right there. I lived just outside of DC, and it was awesome. And, knowing what I do now, yeah, I would go back and live in DC in a heartbeat.
Yeah, that's amazing to hear. Well, thank you so much, Dr. Blair, for your time today. And thank you for our listeners for tuning in. But yeah, I hope everyone has a great rest of their night. And yeah, have a good one.
Sure thing. Thanks a lot. See you, Grace.